Immunotherapy, like any other therapy, has side effects, but not the same as our traditional stereotype we have for, our standard chemotherapy. We think of hair loss, lowering of blood counts, the GI problems people have, nausea and vomiting. With immunotherapy, it's very different. Immunotherapy can cause patients' cells to be revved up, and some of the common side effects are flu-like symptoms, rashes, fatigue, fevers. Those are very common side effects. Some of the less common side effects we see are problems with the patient's lungs, thyroid, and bowel problems or inflammation of their bowels, like something called colitis. Immunotherapy side effects can be mild to very severe, and depending on the severity of it is what we will offer to treat it. If the symptoms are mild, we're able to treat them at home or in the outpatient clinic with things such as IV fluids and diet medication, maybe diet modification, or maybe medication that can be given over the counter. If the symptoms are severe enough, or even what we may say life-threatening, we will admit the patient to the hospital. We're able to check their blood counts and do some imaging to look at their lungs and their abdomen. We're able to give them IV antibiotics. And so you can see why, when they're that severe, they really need to be in the hospital to receive the therapy. Because immunotherapy is newer and evolving, and we are finding that side effects can vary from one person to the next. We don't know what side effect that person is going to have on a list of 10 things. We don't know why some people have some side effects as opposed to others. It's very important that the healthcare team, providers, speak to the patient and their support system, their caregivers, and say, these are the side effects that can happen, and they can be mild to severe. And it is really important to call, even with the slightest change of the person's symptoms, the patient's symptoms, because the symptoms can escalate very quickly. It's not uncommon for someone to wake up with a fever of 99, which is fine, and then within 4 hours it could be 104 and life-threatening. And so it's really important to know what can happen. And I always say, if a patient is thinking about calling, that is the call. Please do not sit home and debate whether the physician is having dinner or it's a silly question. No question or no call is wrong. So always call.